Buffum is in, and he's brought, I'm guessing, the even prettier and smarter wife of his, Chelsea Buffum.
That is quite true.
She's a mental health counselor. Joel is, of course, with Memorial Sports Medicine Advantage, and I guess we're focusing on wrestling, or are we talking about high school athletes in general today?
Well, we can be talking about high school athletes in general. However, wrestling is going to be our most at-risk individuals when we're talking about eating disorders. During this time of year is when we run into a large influx of athletes who are concentrating on weight, and inevitably we're going to be running into issues there.
It is wrestling season. That is true, and I know that my wife teaches at Sunnyside. That's all the rage at the school, and that and the girls' basketball team. But yeah, wrestling has historically been, and they have, you want to bulk up to get to a certain weight or drop weight to get to a certain weight. And Chelsea, I'm sure you see this all the time. These kids, they're so focused on the weight, the number, because that's how they're judged to where they can wrestle, that it becomes kind of crazy for them.
Right, and specifically for men, I would say in wrestling, I think we have more and more women coming into wrestling, but specifically for men, this is where we see the highest percentage of eating disorders.
So I guess so let's start off with the concept. Some people don't understand wrestling, or maybe even if they're kids, they don't really understand wrestling. I never wrestled as a kid. I like the closest I got was watching cartoons with Hulk Hogan and Junkyard Dog. As a kid, that was the closest I ever got to having any sort of wrestling experience as a child. But let's talk about wrestling. You're in a weight class, correct?
You are in a weight class, and one of the things that's currently being done is the athletic trainers in the Valley, they develop descent plans to make sure that kids are not fluctuating weight as much. They basically, before the season starts, there's a weigh-in accompanied with a body fat analysis and actually a hydration test to make sure that they're not dehydrating themselves when they weigh in. But they try and do that first weigh-in, which will determine how much weight they can change throughout the rest of the year, which has been a big initiative in trying to prevent a lot of huge swing dieting, everything like that. However, we're still seeing huge problems that we have athletes that transition from football, where they're trying to be a big, bulky athlete, and as they transfer into wrestling, they're trying to determine, 2 months out, what is their weight going to be, so they try and cut down hard, and that's where we see some of the most extreme techniques in dieting that can end up with disordered eating and long-term issues.
So I guess then, if I'm a parent of a wrestler, what are some of the signs that I need to look for to know if my kid is doing things healthy and properly, or if he's doing some of this fad kind of eating disorder type stuff?
Yeah, that's a great question. I think that a lot of kids will start using diuretics or laxatives. You've seen kids wear like sweatshirts and sweatpants and try to sweat off a lot of weight. If you notice your child kind of doing extra workouts on top of the workouts that are provided in the wrestling program, and two, just sort of counting calories, that sort of thing. You really want your child to be a normal eater, obviously, growing up. And so dieting, becomes sort of problematic in that sense. So those sorts of things are some of the things you can look for.
So I guess the question then is, what are the proper ways for a kid who is a wrestler to go through the process of making sure that I understand there's if I'm 135 and I want to wrestle at 124, I need to lose 9 pounds. But maybe you want to try. Obviously, there's now rules and restrictions in there. But I guess what are some of the proper methods that a kid can do to maybe bulk up or lose weight to get into a specific weight class?
With the when we're dealing with individuals who don't already have disordered eating patterns, I recommend talking with nutritionists on the best ways to make sure they're getting a proper balanced diet with the restricted calories that they're trying to attempt. It's not necessarily going to be that they're going to be able to make that 9-pound drop realistically. And so talking with a sports medicine person, even your primary care doctors, when we have kids who have too little body fat, we actually refer them out to their primary care doctors to make sure it's safe for them to lose that kind of weight. So be consulting with your physician, make sure it's safe to lose that amount of weight. And if you're trying to change your diet, to be talking with a nutritionist or a sports medicine professional, so that way you're making sure you're doing the proper things and not overdoing it or hurting yourself in that process.
So one of the reasons we're doing this, Chelsea, is because there are these aren't just, you don't have this temporary situation. This isn't a situation where like they just this is only for the wrestling season that I'm doing this stuff that's really not healthy. These are effects that last forever, or at least a long time.
Right, and I would say that sometimes kids can get through the wrestling season and have these behaviors and they bounce back. We don't really know why that is, but eating disorder behaviors can last a long time, even if you just kind of start and you think, oh, it's just a diet for a little while. And you can have really bad long-term effects from that, health effects, and psychological effects. I've known of older men who wrestled when they were young kids, and they are still struggling with disordered eating and their weight and body image issues.
Is it worse for girls? My daughter was a wrestler at West Valley for one season. She was a varsity wrestler out there, and she was talking about, I got to make weight. She basically just watched what she ate really well. She didn't go in for any of the laxatives or diuretics or anything like that. But with some of the things that girls have to face anyway when they're teenage girls, body issues and things like that, is it worse for girls?
I would say in a lot of other realms, there's a lot more pressure for girls and women to lose weight and make certain weight or, look a certain way. I would say, though, in wrestling, I'm not really sure if it's necessarily worse for girls or worse for boys. I think since wrestling's historically been a male sport, that boys feel a lot of pressure to make weight that way. So I'm not really sure, but in general, a lot more women do struggle with eating disorders, although men do not necessarily report whether or not they're struggling with eating disorders.
Research has been a little bit limited, and hopefully it'll improve and increase as we have more women involved in wrestling. I think that's probably going to be one of the big things that saves the sport, is having more access for more individuals and a more healthy approach to it. But a good comparison, for example, would be that the incidence of eating disorders we see in men in sports like rowing, jockey sports, or wrestling has similar prevalence of eating disorders as those as ballet and modeling for women. So when you compare those kind of things, hopefully it kind of underlines the issues that we're seeing there.
Joel and Chelsea Buffum. Joel is with Memorial Sports Medicine Advantage. Chelsea is a mental health counselor. If they have any questions, they can go, I'm assuming, to yakamemorial.org or give you guys a call and ask any questions they have. So parents, if your kids are involved in wrestling, these are things to look out for.